Welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. To all our listeners, we're so happy that you've joined us. And please note that you can also subscribe on our YouTube channel or find us on weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us and them a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit, I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open, and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. Joining me today is my colleague, Paul Calori. Paul is the key person behind our signature course, The Path to Be Well. So welcome, Paul.
Good morning, Mark. How are you today?
I'm doing fine. How about yourself?
Oh, I'm doing well. Thank you.
Good. Paul, we had a good session last week, and the topic last week was SMART goals. For those that may not have been connected last week with us, can you give us kind of a very high-level summary of what the topic was, SMART goals?
So SMART goals, it was our first presentation, in fact. And I chose this topic in relation to its timing with New Year's and New Year's resolution specifically. And a SMART goal, or creating a SMART goal, is essentially doing that New Year's resolution, but with a lot more focus and hopefully setting it up that way that you're more than likely or more likely to be successful. So the SMART part of SMART goals is an acronym. The S being specific. We want specific goals. The M being measurable. We want to be able to measure, generally with a yes or no answer when you trying to figure out if you've achieved a goal. So yes or no, I achieved it or I didn't. You want it to be attainable and realistic. These sort of tie into each other. And we talked about it in terms of weight loss. You know, losing 20 pounds in a month, it's not really attainable, nor is it healthy, but maybe setting that goal out 3 or 4 or 6 months later is very attainable. And finally, we want it to be time bound. We want to have a limit on it. We talked a little bit about tests and writing papers and stuff like that in school. And for those of us that wait till the night before, if that time limits on when to turn in your paper wasn't there, we probably wouldn't start the paper. And much like, with losing weight or trying to decrease your pain or walk to the mailbox or whatever the goal is, we want to be able to do it by such and such a date. It was an excellent conversation.
Yes, it was. Pardon me, Paul, and good job in the summary. So, Paul, what topic do you have today for our listeners?
So our topic today we can find in our Be Progressing area, and you can find that on weedwell.tips. It's health journals and health journaling today. And so in a basic sense, health journaling is documenting everything you can about your health. And so it might be documenting a new treatment. It might be documenting a new therapy and how your body and you are reacting to it. It might be documenting or keeping a tab on, I went to the doctor for this. I went to the emergency room because I had an issue last week. And what it is kind of keeping a chronological order of things that are going on. It can be as detailed or little detailed, but it helps jog the memory for sure.
So, and I like the concept, Paul. It makes a lot of sense to me. But how can that really be helpful to a patient? Like, give me some examples.
Okay, Mark, we in our sister show with the Facebook Live, we had an interview with a client that actually their husband suggested they journal what it is, and this was specific to cannabis treatment. They journal what it was that they were feeling, and the comment from the husband to the wife was, you're so foggy, you're going to forget. And I don't know, perhaps Mark, you could share sometime in your life. I know I've gone in and you try to jog your memory as to especially chronic conditions, which is totally what we're talking about. What happened when, and trying to piece it together. And there's a lot of, I think, have you noticed anything like that even within your own life?
More times than I care to admit, but my wife, if she was standing next to me, would remind me of many of those times for sure.
For sure. So having a sheet of paper, a logbook, or just like as a journal says, when we talk about the traditional thing you write in your book at the end of your day at night, we're just relating it back to your health and keeping a handle on things. And so that's in the general sense of things, health journaling.
Yeah. So, Paul, I actually remember that discussion with the client, Cynthia, and her husband saying that. And I believe that Cynthia was saying, like, for her, the value was to be able to go back in time and say, that's right, that's where I was, and here I am now. Because many, including myself, when you found success, it's easy to kind of forget, if you like, the past and the path that got you to the success. So that would be one aspect. The other aspect would be if it's not working now, you go back and verify the steps that you have taken, the dosing perhaps, and so on. Would that make sense, Paul?
You're 100% right, Mark. So, if we use that example of what you were just saying, maybe for you, step 1 and 2 were spot on. You began to feel better. You were doing more, whatever the case may be. And at step 2, you veered right. Well, that journal allows you to go back to around that date. It might be a specific day for you. It might be during a week. And now maybe you can veer left and see if the results differ. But not having that framework or trying to recall on memory, whatever state of our memories are in, you can get confused. You might go back too far, and then you end up in a way different treatment plan. But like you just pointed out, sometimes there's 2 or 3 things that worked really well and you were doing well. You might only need to go back that far before you change course. The health journal just allows assist you with that.
Yes, Paul. A couple of things that come to mind, and going back to Cynthia and the conversation with her, and the husband referring to the fact that she had brain fog. And I remember Cynthia saying that that was part of what she was struggling with, and it may or may not have been related to some of the medication that she was on. Regardless, the brain fog was there. So for her, it was difficult to remember some of those specific details. And we know, Paul, from what we do day to day and conversation that we have with patients, that for the most part, they're not just a simple treatment plan. In some cases, they're very complex, right? Where they're seeing one or more specialists, perhaps, with their own therapy. It could be that they're introducing, because they're able to, some physical activity. And it's re-emphasizes the importance and significance of journaling, because there's a lot of moving parts, and is part of therapy A affecting positively or negatively the treatment with cannabis.
Absolutely. We meet people with chronic medical conditions, and by definition, chronic is gone on for a long time. And like you've pointed out, and especially when they show up to the clinic, I've gone through this treatment, this specialist, and there is a lot of moving parts. Just being able to have a handle on that, being able to describe that, it's also empowering to you, because you know what's going on with your body, what if it's medicine wise, what's going into your body, and then how it reacts. So all really good points with health journaling in general. Today, I think we're going to draw from there and move into cannabis health journaling.
Yeah, Paul, and along with all those things that we've talked about, going back in your journal gives you an opportunity to look in the rearview mirror, if you like, and really celebrate the steps and the success along the way. And even if there wasn't a whole lot of success for a period of time, celebrate the fact that you have remained on the path, and that is your journey. And sometimes you'll see a lot of positive results, or not, but positive results initially, and then it could be a phase where, am I really seeing improvement or not? But stay the course, stay the path.
Absolutely. The health journal, your results or lack thereof, very well can feed into your treatment decisions with cannabis going forward. And more importantly, when you set your next health goal, it might have been that your SMART goal, your health goal, was unrealistic. At the time you thought it was realistic, maybe it was unrealistic. And you have to take a step back to something that is more in your reality. Well, the health journal, like you just said, allows you to go back and actually get a handle on what is in my realm and what is not at this point in time. And you can see how everything circles. It's kind of why it's exactly why we call it a path, and a path to be well, because each part feeds into the next. And even if there's a misstep on the way, you can just circle back and pick back up right where the last step was that was positive, right?
Mm-hmm. So, Paul, I know that you and members of our team have put together, and it's available online, a journaling document, if you like. Can you talk about that? And it doesn't mean that a patient can't use their little notepad that they have been using for some time, but they may also find value to what we have to offer. Can you tell us a little bit about that?
For sure. So with cannabis, we have this huge generic topic. And so we want to break it down, and this will go into your journal. Right from, are you eating your medicine with edibles or capsules, or are you using dosing underneath the tongue, sublingual dosing, or are you using dry? So breaking it down right from there. Then you can start to get into types of cannabis. Joe was a good example of this in trialing, indicas and sativas as an example, and figuring out this wasn't really good. And this I used at the end of the day. It was my sweet spot. I didn't have to go back out. Well, the only way Joe got to that point is kind of documenting where he's at, because there are literally hundreds, if not thousands of strains. And as you begin your journey, you may want to trial a few of them at the same time. And so just having an order of things, I tried this on this day, it gave me this effect. So labeling the strain as to what you're using and how you are using it.
So, Paul, I've heard you mention at some point avoid recency bias.
Yeah.
What does that mean?
Okay. So I think we all have a habit of doing this, and it's remembering the last thing or the last prominent thing in your mind. And sometimes, and feel free to share if you've had this interaction with a client, Mark, they come in and they tell you that treatment hasn't gone well. And that's a very bland, generic statement. But then you start asking questions, especially people that you've seen 2 or 3 times, so you kind of get to know them. And it's like, well, are you doing this? Like last time you told me you weren't doing anything, but are you out of the chair? Are you able to vacuum? Whatever the case may be, activity-wise. And they start answering yes. Well, maybe their last week was very poor. Maybe the arthritis was acting up. But having that journal, you could look back and you start picking positive things out. Treatment isn't bad. Recent treatment hasn't been going as well as I thought it might be. Overall, treatment's gone pretty good when you start picking at that. But for the person to be able to identify that, and you mentioned a very important point, celebrating those wins, right? If they can go back and look at a sheet of paper, I was good this day. I was good this week. I was good this month. There are good things. I think that's important. And so, yeah, I think we get focused on the last most prominent event as a recency bias. And that's what the doctor gets reported, or that's what clients will tell us.
Yeah, good explanation on that, and very good point. And absolutely, as you said, with some of our patients, that is definitely the case. And Paul, as you would know, it's most common that when patients introduce cannabis to their treatment plan, depending on their history, whether they are cannabis naive when they come to see us, we will typically start with very low dosage, including CBD. Even if it is non-intoxicating, we will typically start and suggest starting very low. So I see the titration, so increasing the level of or the amount of consumption of their medicine, important to journal. Would you agree with that?
Yeah. So we started with the type and how you're taking it, the method of consumption, but certainly how much. And so that will give you an idea, especially over time. The step 1 didn't work, the step 2, and I talked about going back and just altering your path. That'll allow you to do that. Much the same as if you change the type. I tried some oil, but I wanted to introduce some flower as well, and I wanted to vape, and I wanted to see how that would work. It can get quite confusing to keep track of it all. But along with all that, you want to document how you feel. So you're 100% right with the amount. But each time you adjust that amount, you want to document how you feel. And if you had any other unwanted effects, side effects. And the side effects might be the cannabis itself, or the side effects might have to do with something else that you're taking. But those generally can all be adjusted out, and you can fix that problem. Again, documenting it, especially when it starts, for timing wise, and we can, or doctors in general, can piece together if there's a relation or not a relation to that.
Mm-hmm. And as well, kind of alongside of that, patients treating with, and I'll use CBD as an example, whereby they've been medicating now for 10 weeks or so. And they reach a point where, say, they're at 0.9 milliliters of a given CBD product. And because of journaling, they're able to really identify that, you know what, I've been at 0.9 for a week or 10 days. I really am not noticing any improvements from where I was at 0.8. So a lot of that can indicate that this is really the sweet spot, or the therapeutic relief has been attained, and likely not 100%. And that could be anything from 0 to 90%, somewhere in there, but that the body is responding to the max of the available benefits of that treatment.
You've said it perfectly, and we tend in the clinic to use that term sweet spot, just like you said, where you've hit the maximum effect, and more importantly, without side effects. So you get the best of both worlds, so to speak, and documenting that and increasing slowly, it's exactly the way to go.
So, Paul, good job on identifying the benefits of journaling, and knowing that anyone listening to this, they're likely to see value in that, and we would strongly encourage them to do that, because it will help in their health treatment goals. Because we have seen that, we have heard that, and those who are journaling just tend to achieve, are better positioned to achieve their goals, I guess, whatever the goal is. And from client A to client B, the goals are likely very different.
Mark, it's goal driven for sure. The other thing is, and this came up with at least three, most of the interviews that we've done previously, and it's the ability to advocate for yourself in your healthcare. And when we go back to that example I gave, where you go into the doctor's office and well, the doctor's not sure. The doctor's not saying you're lying or anything like that, but it becomes very difficult to get to that diagnosis, or maybe what that next specialist or test should be. If you come in with a solid story of this started now, this is happening now, then this came on, you've in a way done the doctor's job, that the next logical step for the doctor to do is going to be A or going to be B, based on you just keeping track of what your body's telling you. And so definitely health goals, but just being a good patient and being a good advocate for yourself. I remember that coming up numerous times during our lives.
Yeah, good point. Good point, Paul. So again, excellent job in identifying the benefits. I'm going to let you wrap up and maybe summarize, journaling.
Okay, so I would love to just put journaling in the context of our path to be well, if we can, because we have worked on another resource also available on weedwell.tips, and that's our roadmap. And so with the Facebook Live, and even to some extent here, you've heard us discuss the path to be well, the path to be well, the path to be well. We've actually made a roadmap, a picture. So it's not just me talking. It's something you can visualize, a step-by-step process. The steps are the same, whether it's be clear, be aware, be informed. Like today's topic, be progressing, where we have a subsection, if you will, of be progressing that we're talking about. And finally, be well. And it's all visual right there. Your roadmap, you can find on weedwell.tips. Health journaling is but one step of it. Very useful tool. Takes little time. It's just something that we need to put in our mind to do, and stay on top of it. Once it's in motion, you just add those little pieces as they go on. As it goes to cannabis, we want people to be on top of what their body's telling them, because it's going to lead into titration changes. We're going to talk about titration at a later episode for sure, and whether or not your SMART goals need to be adjusted or changed the next time round.
Excellent, Paul. Paul, thank you for joining me today. I know that this session, as previous one, are of value, and that those listening will gain some benefits out of this. In closing, I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including mental health disorders. So these information sessions do not involve the diagnosis or treatment of any medical or mental disorders, and do not prevent, cure, or treat any mental disorder or medical disease. So further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice of services of medical professionals. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those of you who have taken some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And as long as you are taking some steps forward in improving the quality of your life, you should be proud of the progress that you are making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of our team, including those behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.